The Johnson & Johnson COVID-19 vaccine is now formally under review by federal health officials after those 6 women reported blood clots within 2 weeks of their dose.
But how likely is the average person to develop a blood clot from the vaccine? Western Mass News reporter Audrey Russo is getting us answers. She joins us live in Chicopee with what she's learned. Audrey?
Statistically, you're more likely to get struck by lightning or hit by a car than to develop a blood clot from the Johnson & Johnson vaccine. Now, those factors are commonly out of people's control, but we wanted to look into some more common risk factors like birth control use and smoking.
Do you need some water?
Out for an afternoon trip in Forest Park, Connecticut resident Nicole Blanks tells Western Mass News she already received a different shot against COVID-19. But she says if she were given the choice to try the single-dose Johnson & Johnson jab, she would if the government's review deemed it okay.
Once the CDC continues their research and if they felt like it was safe, yes, I would move forward and get that if I wasn't already vaccinated.
The Centers for Disease Control and Prevention and the Food and Drug Administration recommending a halt on that shot after 6 women reported blood clots. 6 women out of nearly 7 million doses administered nationwide. But Western Mass News found that a person's risk of getting blood clots from oral birth control alone is higher than the Johnson & Johnson vaccine. Higher risk still is smoking. And the highest blood clot risk of all, a COVID-19 infection. The virus that J&J shot is meant to stop.
The risk of that particular type of blood clot is more common in patients who have COVID.
Baystate maternal fetal medicine physician Elizabeth Morgan says it's worth reviewing whether or not the 6 people who got the blood clots were sick to begin with.
It could be that some people are getting the vaccine who already have a mild form of COVID.
But in the short term, Morgan says she's telling her patients, whether they're on birth control or pregnant, to get vaccinated as soon as they can with whatever's available.
We still recommend either the Pfizer or the Moderna vaccine in those patients.
Good news, as Governor Charlie Baker says, pausing the Johnson & Johnson vaccine won't disrupt the state's rollout too much.
It's a relatively small part of our distribution to date, and we do have and expect that we'll continue to see modest growth in the Pfizer and Moderna supply going forward.
Now, we asked the Baystate doctor about those blood clots and the difference between males and females. She says anyone of any sex can develop them and that you should consult your doctor if you start to experience leg pain, headaches, confusion, or trouble breathing. Live in Chicopee, Audrey Russo for Western Mass News.